Starting this year, a new Oregon law helps secure more than $140 million annually for improving mental health care.
But something in all this, smaller mental health care providers are saying all the red tape is preventing them from taking part in the publicly funded program. With that, we did send Elise Haas to find out what exactly can be done to remove those barriers, as people need that help.
Yeah, and a big issue is that there simply are not enough mental health care therapists to treat people right now. And a lot of money is being put into the Oregon Health Plan in order to raise rates and in turn raise the wages of mental health care workers so they'll want to stay in this line of work. But as smaller mental health care providers have tried to apply for their certifications to be a part of the Oregon Health Plan, they're feeling stonewalled. Addressing mental health care has become Oregon's focus in recent years. The state and federal government have pledged to put millions of dollars toward the problem. While their work to improve wages for mental health care workers is the latest step, owners of smaller practices say the barrier to entry to benefit from this government money are concerning. Mental health care providers say the application process to become in-network with the Oregon Health Plan to get paid for treating Medicaid patients is burdensome.
It takes over a year. Three of their staff had to do it. There are multiple revisions, from OHP back, and someone quoted me, support to help me do my application. It will cost $5,000. I've since learned people have been quoted up to $10,000 to help with this application.
What's your reaction to that?
It's ridiculous. It's absolutely ridiculous.
There's often a lot of paperwork involved in being part of the network, but unfortunately, we have sort of regulation stacked upon regulation, and a lot of those rules, they exist for reasons.
Oregon Representative Rob Noce chairs the Committee on Behavioral Health. In recent years, he says lawmakers have attempted to reduce the paperwork process.
We have not succeeded at that, to be totally honest with you.
But he says it's an issue he aims to address more head-on with another bill this year.
We're going to task the Oregon Health Authority with hiring a research analyst, pulling people together and having a solid argument about, okay, here's the regulation that creates burden that we don't think is adding a lot of value.
Once OHA has reviewed the current rules and regulations, he hopes to have a bill ready to break down the bureaucracy of mental health care in 2024. So I listened in on an orientation that Oregon Health Authority puts on regularly, and I was listening to that this morning, and they basically teach mental health care providers how to fill out their certificate of approval. And the person who is leading the orientation, the compliance specialist, acknowledged multiple times just how labor intensive the process is. And while nothing in government is a quick fix, Representative Noce wants smaller mental health care providers to know that this problem is on his radar.
Yeah, that's really the thing, because so many times when we have these stories that come out, people are like, we've got to tackle mental health issues. And that's the big problem, is tackling it takes on many other hurdles for all of these people who are trying to help out.
Yeah, when you say you want to tackle something with urgency and then you give all this time-consuming paperwork, it leads to questions.
How about eliminating the barriers to
exactly.
providing mental health? And